Okay, so I'm going to give a report on Richard Ruff. He is a 43-year-old patient who came into the ER with abdominal pains and worsening nausea and vomiting. He came in on 3/25. He has a diagnosis of liver cirrhosis. He denies of any alcohol this past week, and he has binge drinking on most weekends. He is single, lives alone, and has a history of heroin abuse. He is currently is unemployed and was diagnosed with hepatitis C about 10 years ago and had not had any follow-ups. His current medications at home are ibuprofen, 600 milligrams PO. So his vitals were 38.1, his pulse was 110, respiratory rate 20, his blood pressure was 120/80, and his SpO2 was 95 on room air. He reports pain on his right upper quadrant. He rates it a 6 out of 10. It's an aching pain that's continuous. Let's see. Neurologically, he is alert and oriented ×4. His skin is dry with +1 pitting edema in his bilateral lower extremities. He has regular rate. His pulse is strong, equal in the pedal, radial, and posttibial. His lung sounds are clear with non-labored breathing. His abdomen is distended, large and round, firm to touch, and there are sounds in all 4 quadrants. He is voiding freely. His urine is clear, and his skin is intact. Color is within normal limits. He has yellowing in his eyes, lips, and mucosa is dry, and he has a bruise on his abdomen. And then his lab values, my patient has high WBCs and neutrophils, could be because of a viral infection and inflammation. My patient also has elevated creatinine and bun levels and low potassium. The creatinine could have been because of the nephron functioning loss, and then the bun could have been elevated from dehydration, and then my patient also has high total bilirubin, AST, ALT, and ammonia. Those show signs of liver damage. And then and that's it. And then he also has his IV was inserted on his left hand on 325 20 gauge.